So, good evening, everyone. Sorry, good morning. Good morning, everyone. And happy Diwali to all of you. Bhagwan करे आपकी सारी खुशियां, the all happiness, prosperous, everything comes in your life by this Diwali. Okay? आप सबका एमसीए में सिलेक्शन हो जाए, आप सब पास होके फ्यूचर बनाओ, माँ बाप का आशीर्वाद लो और देश का नाम रोशन करो. दिस इज ऑल अबाउट. तो डॉक्टर साहब ये ध्यान रखना कि दिवाली खुशियों का त्योहार है, खुशियां बांटने से बढ़ती है. ओके, ये ध्यान रखना. Anyways, sir, we are coming to the point which is very important: putrefaction. Dr. Sir, putrefaction, I told you the decomposition and putrefaction are late changes. Putrefaction is internal change, my dear friend. It is internal change. Decomposition is external. And my dear friend, putrefaction is surest sign of death. If you get a question, which is the surest sign of death, the answer is putrefaction. Putrefaction is the surest sign of death. Now, sir, what is the first change of the putrefaction? First change of the putrefaction is brownish discoloration of BV, blood vessels. First change of the putrefaction is brownish discoloration of BV. What is BV? Blood vessels. Second, the greenish discoloration of undersurface of liver. Anyway, sir, the first change of the putrefaction is brownish discoloration of BV. BV is blood vessels. First organ to be putrefied is the organ. First organ to be putrefied is an organ which is in direct contact with air. That's the larynx and trachea. So, my dear friend, first organ to be putrefied, it is larynx and trachea, which are in direct contact with air. So, doctor, if you get a question, which is the first organ to be putrefied? Then larynx and trachea. Which is the first change in the putrefaction? Brownish discoloration of the blood vessels and greenish discoloration of the liver. Now, sir, after larynx and trachea, भगवान ने आपको दो बड़े बड़े L दिए हैं, 2L. The number one L is liver, another L is lung. Doctor Saab, in liver, there is a foamy appearance. So, Doctor Saab, this is a liver. This is gas formation in the liver. This is known as foamy appearance, and it is also known as honeycomb appearance. This question comes in exam. Liver, it is showing foamy appearance or honeycomb appearance. Foamy appearance and honeycomb appearance that is seen in liver. Foamy appearance and honeycomb appearance of the liver is a putrefaction. Now, after this, you can remember brain, heart, and uterus. You can remember by BHU, Banaras Hindu University, brain, heart, and uterus. Now the question comes in exam. In the female, which is the last organ to be putrefied? The answer is uterus, but just remember, this is non-gravid uterus. The last organ to be putrefied in female is non-gravid uterus. Not gravid, it's a non-gravid. But this question comes, if the question comes regarding the male, in male, the last organ to be putrefied is prostate gland. Doctor, remember, if the male and female word are given, it's a uterus or prostate. And if male and female word are not given, the overall last organ, it will be both. First organ, larynx and trachea, honeycomb appearance in liver, female last organ, non-gravid uterus, male last organ, prostate. And if male and female are not given, my dear friend, then the answer will be both. Then the answer will be both. Dr. Sahab, Taylor had given one formula. This formula, putrefaction is an internal change. Decomposition is external change. First organ, last organ, male last organ, female last organ. If male and female are not given in option, then the answer would be both. Dr. Sahab, Taylor has given a formula. This formula is Caspar dictum. What is Caspar dictum? Caspar dictum is rate of decomposition in different climate. Rate of decomposition in different climate. Air, water, and soil. So if you see, the maximum rate of decomposition is in air, then in water, then in soil. This formula was given by Caspar dictum. Now, sir, if air takes 1 week to decompose, the same decomposition, water will take 2 weeks, and the same decomposition, soil will take 8 weeks. Air, it takes 1 week. Water, the same decomposition will take 2 weeks. The same decomposition in soil, 8 weeks. It means, sir, maximum rate of decomposition is in air. This formula was given by Taylor. This is Caspar dictum. Now, sir, I'm coming to decomposition. I told you the internal change is putrefaction. Decomposition is an external change, my dear friend. Decomposition is also a surest sign of death, same like putrefaction. It is also a surest sign of death. Now, sir, this question comes in exam, very, very potential. What is the most common microorganism causing decomposition? It is Clostridium welchii. And also in microbiology, you all know that Clostridium welchii is Clostridium perfringens. Now, sir, the most common enzyme responsible. The most common enzyme responsible is lecithinase. And remember one concept, my dear friend. Lecithinase is a lytic enzyme, so it will lyse the body. Most common bacteria is Clostridium welchii. Most common enzyme is lecithinase. Lecithinase is a lytic enzyme. Very, very potential MCQ. Now, the first change of the putrefaction was brownish discoloration of the blood vessels. That was putrefaction. Now I'm coming to external change. First change of the decomposition is greenish discoloration of right iliac fossa. Greenish discoloration of right iliac fossa. Why, sir, it is green? Sir, it is green because of sulfa hemoglobin. It is green because of sulfa hemoglobin. And why it starts from the right iliac fossa? Because just beneath the right iliac fossa, we have cecum, and the maximum bacterial activity are in cecum. And Dr. This greenish discoloration of the right iliac fossa in summer, it is seen in 12 hours. Clostridium welchii, main enzyme is lecithinase. First change of the decomposition is greenish discoloration of the right iliac fossa. Two question comes, because of sulfa hemoglobin. And why it starts from the right iliac fossa? Because right below the right iliac fossa, we have cecum. And in summer, what is the time required for this greenish discoloration? This would be 12 hours. You can see this is the right iliac fossa. It start becoming green. Okay. Now, sir, I'm coming to second one. Second change of the decomposition is a phenomena which is known as marbling. Sir, what is marbling? Your superficial veins are distended. So first, I will show you the picture, and the picture is given in your booklet also, don't worry. This phenomena is known as marbling. Your superficial veins are distended. So I'm coming back to the slide again. Marbling, your superficial veins are distended. This question comes in exam. Marbling is visible in 24 hours. Greenish discoloration, 12 hours. Marbling in 24 hours. Marbling, superficial vein become prominent, especially your chest, thigh, or shoulder. And observe, maximum time for marbling means maximum marbling is seen in 36 to 48 hours. And observe, the color of marbling is again reddish purple. The color of the marbling is again reddish purple, and the pigment is same sulfa hemoglobin. Dr. Saab, I told you, greenish discoloration of the right iliac fossa is also sulfa hemoglobin, and the marbling color, which is reddish purple, It is also sulfa hemoglobin, and maximum time for marbling is 36 to 48 hours, and it starts in 24 hours. What are the area? Thigh, chest, and shoulder. Now I'm coming to maggot formation, sir. Actually, sir, what is maggot? Maggots are pupa of your flies. House flies form pupa on your body. This is known as maggots. And Dr. I will share this picture also. This is maggots. Maggots, the white color pupa of the fly, these are known as maggots. Very, very potential word. Sir, what is the time for maggot formation? 48 hours. In bracket, you can write down 2 to 3 days. 48 hours. In bracket, you can write down 2 to 3 days. But sir, in rainy season, it start earlier, 24 hours. In rainy season, it start earlier, 24 hours. Or in bracket, you can write down 1 to 2 days. Maggots are not larvae of the fly. Maggots are pupa of the fly. 48 hours normal time. Rainy season, 24 hours in 1 to 2 days. And Dr. Saab, this question comes in exam. Study of maggot is known as entomology. Dr. Saab, what is the use of the entomology? It gives idea about time since death. It gives idea about time since death. Very, very important. The study of maggot is known as entomology. It gives idea about time since death. So, sir, Green's escalation of the right iliac fossa, marbling in 24 hours, 48 hours maggots. Now, the fourth change after 3 to 4 days, what happens? Dr. Sir, after 3 to 4 days, the face is distended. After 3 to 4 days, the face is distended. I will show you that picture also. Hair loose in 72 hours. Teeth loose again 72 hours. Face is distended. Hair loose in 72 hours. Teeth become loose 72 hours. Now, sir, because the gas forms in your body, so vomiting and frothing, vomiting from the mouth and frothing from the nose. Actually, it's not vomiting. Actually, we should not use the word vomiting. It's a regurgitation. Because of the gas formation, vomiting and frothing comes from the mouth and nose. This phenomena is known as postmortem purge. And Dr. Saab, postmortem purge is seen in 2 to 3 days after death. 5 to 10 days after death, a very, very potential MCQ. 5 to 10 days after death, we have colliquative necrosis. A very potential MCQ comes. 5 to 10 days after death, we have colliquative necrosis. After 3 to 5 days, face is distended, hair loose, 72 hours, teeth loose, 72 hours. Vomiting and frothing from mouth, this phenomena is known as postmortem purge in 2 to 3 days. And after 5 to 10 days, I'm coming to very, very important point. After 5 to 10 days, we have colliquative necrosis, a very, very potential MCQ. This question I have seen in many exams. After how many days you have colliquative necrosis? 5 to 10 days. 5 to 10 days. This is the Green's discoloration of the right iliac fossa. This is marbling. This is entomology. This is facial distension. Just correct this. Postmortem purge, vomiting and frothing comes in 2 to 3 days. Postmortem purge, vomiting and frothing from the nose and mouth comes in 2 to 3 days. Very, very important. Okay. So this is another very, very potential MCQ. Postmortem purge, vomiting and frothing in 2 to 3 days. Now, sir, one type of decomposition is mummification. Sir, mummification is seen in dry and hot climates. Sir, it is seen in dry and hot climate. Dry and hot climate. Sir, water comes out, so your body will be shrunken. Water comes out, so your body will be shrunken. And Dr. Saab, this mummification is also known as very, very potential MCQ. I'm coming to. The water comes out, the body is shrunken. The mummification is also known as desiccation. In dry and hot climate, the body, water will come out, the body will be shrunken. This question I have seen in many exams. The smell of the mummified body is odorless. Look, sir, क्या question बनते हैं अभी तक? Mummification is known as desiccation. Yes. What is the smell of the mummified body? Odorless. Why it is odorless, sir? No involvement of Clostridium velci or lecithinase activity. So it doesn't lyse the body. No involvement of the Clostridium velci or lecithinase activity. No lysis of the body. That's why I would say the natural feature of the body are preserved. The natural feature of the body are preserved. Means your bone, your prominence, these will remain as it is. Natural feature of the body are preserved. Now, Dr. Saab, what are the use of mummification? Yes. Number one, it gives idea about climate. It gives idea about the climate. As I told you, dry and hot climate. Sir, it gives idea about time since death. 3 months to 1 to 2 years. Generally, it takes for whole body to get mummified. 3 months to 1 to 2 years, the whole water content is out. And Dr. Saab, I told you the natural features are preserved. That's why identification is comparatively easy. 4 questions from this. Mummification is also known as desiccation. What is the smell? Odorless. What is the time? Almost 1 to few years. And Dr. Saab, what is the use? Identification is easy, my dear friend. Natural feature of the body are preserved. As you can see, my dear friend, natural feature of the body are preserved. As you can see, this is mummified body. The water content is out. Water content is out. Now I am coming to the next type of decomposition, which is adipose hair. My dear friend, adipose hair is also known as grave wax. Adipose hair is also known as grave wax. And another name is saponification. Another name is saponification. Dr. Saab, adipose hair is also known as grave wax, and another name is saponification. What factors, sir? If the surrounding climate is warm and humid, I told you in mummification, dry and hot. If the surrounding climate is warm and humid, or if the body is in water, 2 conditions. Surrounding climate is warm or humid, and if the body is in water, Dr. Saab, bacteria is same, but enzyme is different, my dear friend. Bacteria is Clostridium velci, but enzyme is lipase. And Dr. Saab, everyone knows that lipase act on the fatty parts. Like when the more fatty parts like abdomen, breast, this face, fat, these are the first involved. And Dr. Saab, because of the lipase enzyme, the fat of the skin, yes, the fat of the skin forms adipose hair. The fat, Dr. Saab, only difference is it's not lecithinase, it is a lipase. Bacteria is same, Clostridium velci. Bacteria is same, but climate, it's a warm and humid, or bodies inside the water. And Dr. Saab, it is also known as grave wax or saponification. Now, sir, how the fresh adipose hair look like? See, greasy, translucent, and ammonical smell. Greasy, translucent, or ammonical smell, or I would use a word, rancid butter smell. Greasy, translucent, or ammonical smell, or I will use a word, rancid butter smell. Greasy, translucent, or ammonical smell, or I will use a word, rancid butter. Sometimes this question comes in exam. Rancid butter smell is a feature of fresh adipose hair. Old adipose hair, hard, it's a hard, brittle, hard, brittle, and Dr. Saab, it is sweet smell. Hard, brittle, it's a sweet smell. So Dr. Saab, I will highlight both smell, my dear friend. Number 1 is ammonical smell or rancid butter smell. Number 2 is sweet smell. Dr. Saab, sometimes we are confused whether it is sweet or ammonical. That's why both are known as pseudo smell. That's why the both smell are known as pseudo smell. Greasy, translucent, ammonical, rancid butter smell, fresh adipose hair. Hard, brittle, sweet smell, that is old adipose hair. Both are known as pseudo smell. Dr. Saab, India, both are known as pseudo-smell. So sometimes a question comes, pseudo-smell is a feature of adipocere. India is a humid country. What is the time required for this? 3 days is the minimum time, 3 weeks are the maximum time. So in India, adipocere can start in 3 days, can take 3 weeks maximum. Fetus below 7 months of age, adipocere is absent because there's, I told you, fetus below 7 months of age, rigor mortis is absent. Fetus below 7 months of age, adipocere is also absent. The reason is there is no subcutaneous fat. Now the same use, my dear friend, which I told you in mummification. What are the use? Number one, it gives idea about climate. It gives idea about climate. Number two, 3 days to 3 months. So it gives idea about time since death. And number three, sir, because there is no lecithinase activity, my dear friend, it's a lipase enzyme activity. Because it lipase involves the fatty part. It's adipocere or saponification of Graves. It is identification is comparatively easy because lysis is not possible. So this is adipocere. Warm and humid climate, body in water, 3 days to 3 weeks, pseudo smell, ammonical or rancid butter smell, less than 7 months it is absent. It is adipocere. Use are same. Climate, time, and identification is comparatively easy. A very, very potential MCQ. Doctor, this is a greasy translucent body. It is adipocere. Yes, my dear friend. Now, Doctor, if someone died due to starvation, starvation means lack of food, lack of water. If someone died due to this, most characteristic postmortem finding is gallbladder distension. So very, very potential MCQ. Most characteristic postmortem finding of starvation is gallbladder distension with bile. Gallbladder distension with bile. It's a postmortem most characteristic finding. Gallbladder distension with bile. If you want to add, you can add with bile. Now, sir, embalming fluid. Sir, what is embalming fluid? We inject embalming fluid in the body to preserve the dead body. We inject the embalming fluid in the body to preserve the dead body. Rockstar, embalming fluid in the body can be used by or can be injected by two methods. Number one, cavity method. We are putting the embalming fluid in the cavity method. Number two is blood vessels, vascular method. We are putting in blood vessels. And Aksar, if you are transporting body from one place to another, you should go for embalming, my dear friend. And sir, embalming is always after postmortem because you are injecting some chemical that can change the cause of death. So embalming should always be done after postmortem. I will tell you, if you do it before postmortem, is it punishable? I'll tell you. Now, sir, a very, very important MCQ comes. What are the method? Cavity method, blood vessels method. Embalming should always be done after postmortem. And my dear friend, what is the constituent of the embalming fluid? Number one, formaldehyde, methanol, phenol, glycerine, sodium chloride, sodium citrate, water. Again, I'm telling you, formaldehyde, methanol, phenol, glycerine, sodium chloride, sodium citrate, and water. This is embalming fluid that will preserve the body for a longer period. That will preserve the body for longer period. But Doctor, as I told you, if you do embalming before postmortem, sir, if you do embalming before postmortem, there will be IPC for a doctor punishable under 201. What is 201? I already told you. Disappearance of the evidence, sabuto ko mitana. So embalming done before postmortem is 201 IPC. 201 IPC. Doctor Saab, if you have unclaimed dead body, Doctor Saab, unclaimed body, no relatives were found. Sir, minimum preservation time for unclaimed dead body is 72 hours. Minimum preservation time for unclaimed dead body is 72 hours. It's very important MCQ. You will preserve that body for 72 hours. Any medico-legal document. So medico-legal document means like postmortem report or medical certificate, medical legal document. Dr. Saab, any medical legal document minimum should be preserved for 10 years. Again, I'm telling you, embalming done before postmortem, which IPC would be applicable? 201. What are the two methods of embalming? Cavity or blood vessel method. What is the composition of embalming? Formaldehyde, methanol, phenol, glycine, sodium chloride, sodium citrate, water. Unclaimed dead body, minimum time of preservation is 72 hours. And medical legal document, कोई भी medical legal document हो, आपको hospital में at least you have to preserve for 10 years. Now, Dr. Saab, in few declaration, few definition were given. Sir, oath was given in Declaration of Geneva. How would you remember? Oath is genuine, Geneva. Torture was defined in Tokyo. And Dr. Saab, for torture, you can get one more MCQ. Torture was also described in Istanbul. And Dr. Saab, you all remember, sir, Istanbul is also in Turkey. So the trick will be very simple. To torture, to Tokyo, to Turkey. That's very simple. Sydney, dead. In Sydney, death was defined. Death was defined in Sydney Declaration. Munich, medicine was defined. Helsinki, human experimentation was defined. I'm telling you the trick. Oath is genuine. Geneva में define किया गया था. Torture, Tokyo, Turkey, Istanbul. C, death. Munich, M, medicine definition. H, Helsinki, H, human experimentation. These declarations, these were defined because sometimes the question comes about the declaration. Now, sir, Oslo has 2 O, very simple trick. Therapeutic abortion has 2 O. That's very simple. Venice is terminal illness. The same sound is illness. But sir, Washington people, they are talking about biological warfare. Washington people are talking about the weapon. So they are talking about the biological warfare. So Dr. Saab, O, Oslo, O, abortion, O. Venice, terminal illness. Venice, it's a terminal illness. And Washington people, they are talking about the weapon. So it will be biological warfare. Look, sir, this is all about a very, very important topic, my dear friend. This is taphonomy. We have discussed the postmortem changes and everything. O genuine होती है, to होता है, Sydney में death होती है, M होता है, H होता है, O होता है, Venice terminal illness, and Washington it's a biological warfare. A very, very potential MCQ. Now I'm coming to a very simple but very important topic, my dear friend. Very simple but very important topic, my dear friend, toxicology. Doctor Saab, everyone knows toxicology is a study of poison. Toxicology is a study of poison, and the father of toxicology is Orfila. You can see the father of toxicology is Orfila. The father of toxicology is Orfila. Very, very potential MCQ. So if you get a question, who is the father of toxicology? The answer is Orfila. Doctor, whenever I write down AD, that will be antidote. Whenever I write down AD, that will be antidote. Doctor, I am coming to universal antidote. Universally, what is present, my dear friend? Everyone knows universally ATM is present. ATM, A, activated charcoal, T, tannic acid, M, magnesium oxide. You can see ATM. 2 parts of the activated charcoal, 1 part of the tannic acid, and 1 part of the magnesium oxide. Doctor, what is the composition of the universal antidote? ATM, activated charcoal, tannic acid, magnesium oxide. Maximum part is activated charcoal. So if you see the activated charcoal, like you can see, this is a black powder. You can see this is activated charcoal. This is a black powder. So Doctor, here I'm writing down. This is a black powder, activated charcoal. It absorbs the poison. What it does, my dear friend? Not absorb, my dear friend. It absorbs the poison on surface. Dose is 1 gram per kilogram. And Doctor, because activated charcoal absorbs the poison, it is an example of physical or mechanical antidote. It is an example of physical or mechanical antidote because it absorbs the poison. It is an example of physical or mechanical antidote. It is a activated charcoal because it absorbs the poison, absorb on the surface. What's the dose of the activated charcoal? 1 gram per kilo. What is the universal antidote? ATM. Dr. Saab, by opium or alcohol poisoning, you go in coma. And Dr. Saab, for opium and alcohol poisoning, you go in coma. You use coma cocktail. What you use, my dear friend? Coma cocktail. Coma cocktail is used in the opium and alcohol poisoning when you go to coma. How would you remember, sir? DNB1. Dr. Saab, when you will appear DNB exam for first time in your life, DNB exam, first time in your life, D for dextrose. When you will appear DNB exam first time in your life, DNB1, you will go in coma. Dextrose, naloxone, and my dear friend, vitamin B1, which is known as thiamine. So what is the composition of the coma cocktail? DNB1. How would you remember, sir? When you will appear DNB exam first time in your life, you will go in coma. देखो, universally क्या मौजूद होता है? ATM. Coma cocktail में क्या होता है? DNB1, dextrose, naloxone, and vitamin B1. Okay, dear. Doctor Saab, hemodialysis is contraindicated. Whenever I write down CI, that's a contraindicated. Sir, hemodialysis is contraindicated in KBC hero. कौन बनेगा करोड़पति हीरो? डॉक्टर साहब, कौन बनेगा करोड़पति हीरो? इज अमिताभ बच्चन. We don't want hemodialysis to him. We pray for his long life. Are yes or no, my dear friend? So hemodialysis is contraindicated in KBC hero. Very, very simple trick. K for kerosene, B benzodiazepine, C, there are two C, my dear friend, chloroquine and copper sulfate, and hero for heroin, and O for organophosphate. That's a very simple trick. Again, I'm telling you, my dear friend, hemodialysis is contraindicated in KBC hero. What is KBC hero? K, kerosene, it is not done. B, Z. D, benzodiazepine, it is not done. C, chloroquine and copper sulfate, it is not done. Heroin and organophosphate, it is not done. So this is the way we can remember hemodialysis is contraindicated in KBC hero. कौन बनेगा करोड़पति hero? Clear, sir? Doctor साहब, we do gastric lavage. Gastric lavage is a stomach wash. Stomach को धो डाला. Doctor साहब, for gastric lavage in the treatment, we use a tube that is known as Ewald tube. For gastric lavage, we use a tube. What's the name of the tube, dear? It is a Ewald tube. I will show you the picture. The picture of the Ewald tube is given in the next page, my dear friend. KBC hero hemodialysis is contraindicated. For gastric lavage, we use a tube. What's the name of the tube? Ewald tube. Now, sir, Ewald tube, gastric lavage is contraindicated. CI, contraindicated. Doctor, this is not a contraindication. Just correct this. This is a indication. The last third line is not a contraindication. This is an indication. But gastric lavage is contraindicated. Number one, contraindicated in corrosive. This is a Ewald tube, as I told you, corrosive. Why in corrosive gastric lavage is contraindicated? Sir, we are taking corrosive. Corrosive cause burn, thin mucosa. Doctor Saab, if it is a thin mucosa, there are chances of perforation. Doctor Saab, that's why gastric lavage is contraindicated in corrosive. What is the reason? It's perforation. Second, sir, kerosene, my dear friend. Kerosene, gastric lavage is contraindicated. Sir, kerosene is a volatile poison. In kerosene, there are chances of aspiration. Both question comes in exam. Both question comes in exam. In corrosive, gastric lavage is contraindicated because of perforation. And in kerosene, gastric lavage is contraindicated because of aspiration. But sir, there is one corrosive. I'm coming to very, very important point, my dear friend. One corrosive. What's the name of the corrosive, dear? Carbolic acid. One corrosive where we can go for the gastric lavage. It's a carbolic acid. The reason is, my dear friend, highlighting again and again. The reason is in carbolic acid, mucosa is not thin. It's a leathery mucosa. Dr. Saab, if you had a question, only corrosive where gastric lavage can be done, the answer would be carbolic acid. Otherwise, in all corrosive, because of perforation, all kerosene, because of the aspiration, gastric lavage is contraindicated. Which tube is used for gastric lavage? EVAL tube. EVAL tube. Now, sir, if you died due to poison, we will go for postmortem. And in postmortem, we go for toxicological analysis. In postmortem, we'll go for toxicological analysis. Toxicological analysis, we use some sample. Very, very important, sir. What are the samples, sir? Remember, blood 100 ml. What we take? Blood 100 ml. What is the best preservative for 100 ml of blood? Sodium fluoride. Blood we take 100 ml. What's the best preservative for blood? It is sodium fluoride. Urine also almost 100 ml. What is the best preservative for urine? Toluene and thymol. Blood, we use sodium fluoride. This question comes in the biochemistry also. What is the best preservative for blood? Sodium fluoride. Urine, how would you remember urine? Urine, toluene, the same sound. Urine, toluene. For urine, the best preservative is toluene or thymol. These are the viscera. These are the viscera, stomach and its content, intestine 30 centimeter and its content, liver more than 300 gram plus gallbladder, half kidney each and half spleen. Again, I'm revising. Blood best preservative, sodium fluoride. Urine, the best preservative is toluene. Second is thymol. What are the viscera preserved? Stomach and its content. Small intestine or intestine 30 centimeter with its content. Liver 300 gram plus gallbladder, GB's gallbladder, half kidney each and half spleen. So these are the viscera. Now the question comes in exam, what is the best preservative for viscera? Sir, the best preservative for viscera is rectified split. The best preservative for viscera is rectified split. And my dear friend, best is rectified split, but sir, this is expensive, my friend. Best is rectified split. This is expensive. Most common use preservative is common salt. Most common use preservative is common salt, because common salt, solution of the common salt is very cheap. In India, we use common salt, saturated solution of the common salt, but the best preservative is rectified split. Now, sir, I am putting two questions. For histopathology, the best preservative is formalin. Very important, sir. For virology, the best preservative is glycerin. This I added here again. For histopathology, the best preservative is formalin. For virology, the best preservative is glycerin. For viscera, the best preservative is rectified split. But most commonly used is common salt. Most commonly used is common salt. So just remember these concepts also. Blood, sodium fluoride. Urine, sound is toluene and thymol. Viscera, best preservative is rectified split. Most commonly used is common salt. It's a cheap product. Histopathology, formalin. Virology, it's a glycerin. So now I'm coming to first poison, my dear friend. Very, very important. First poison. Sir, concentrate on first two alphabet and last two alphabet. Arsenic. C is the last alphabet. Arsenic look like a disease, which is cholera. Last is done. Last is done. Arsenic look like a disease, which is known as cholera. Cholera. IC. A. First alphabet is A. In arsenic poisoning, we have Eldridge-Mees line on the nail. We have Eldridge-Mees line on the nail, my friend. Eldridge-Mees line on the nail. Single line. A done, R. 2 R of the arsenic. Very, very important, sir. Red velvety mucosa, leathery mucosa, I told you in carbolic acid, red velvety mucosa, and raindrop pigmentation. Very, very potential MCQ. Red velvety mucosa and raindrop pigmentation are seen in arsenic. So A is done, R is done, C is done, I see. Sir, iron oxide is an antidote. The chemical antidote is iron oxide. But sir, I'm telling you one more thing. Iron oxide doesn't come as an option. Option come ferric oxide. Iron oxide doesn't come as an option. Option comes hydrated ferric oxide. So be careful. Be careful. Roxal, A, Eldridge Mees line on the nail. I will show the picture. R, red velvety mucosa and raindrop pigmentation. I, iron oxide is antidote. C, it look like a disease, cholera. Arsenic poisoning look like a disease, cholera. Now, sir, the chelating agent for arsenic is BAL. The chelating agent for arsenic is BAL. What is BAL? British anti-leucide. What is BAL? British anti-leucide. And my dear friend, BAL is also known as dimercaprolol. BAL is also known as dimercaprolol. British anti-leucide, which is known as a BAL, and BAL is also known as dimercaprolol. BAL is also known as because I have seen one question in ionized set exam. Chelating agent. What is chelating agent? Which is used for metal only. BAL is also known because I have seen one question in the in ionized set exam. What is the treatment for arsenic poisoning? And BAL was not given an option. Dimercaprolol was given an option. Okay. Arsenic causes black foot disease. Eldridge Mees line we already discussed. Arsenic causes black foot disease. Now, sir, FD. FD is fatal dose. Fatal dose of arsenic is 100 to 200 milligram. In acute intoxication, arsenic goes in liver. In acute poisoning, arsenic goes in liver. In chronic poisoning, it goes in bone, skin, nail, and hair. Again, I'm coming to my dear friend, all the question. I, iron oxide, C, cholera. AR, A, Eldridge Mees line, single line on the nail, A. R, red velvety mucosa, raindrop pigmentation, AR, done, okay. What is the chelating agent? BAL, British anti-leucide, also known as dimercaprolol. Arsenic causes black foot disease. This is a very important MCQ, black foot disease. Fatal dose is 100 to 200 milligram. In acute poisoning, it goes in liver. And in chronic poisoning, my dear friend, very, very potential MCQ, bone, skin, nail, hair. It goes in. Sometime a question comes like metals are present. Metals are present in bone. Arsenic can be present in bone, skin, nail, hair. So this is Mees line. This is Mees line. This is Mees line. A very, very potential MCQ. So another potential MCQ, the answer is Mees line. Very, very important one. The answer is Mees line. Is it clear, sir? It is clear. So arsenic is done without any doubt. Arsenic is done without any doubt. ARIC. I told you the trick, which is very, very important, my dear friend. I told you the trick, which is very, very important for arsenic. Yes or no, my dear friend? Is it clear, sir? Now I am coming to lead. Very, very important. Lead poison. Lead. Lead is also known as PB. Lead is also known as PB. PB. Okay. So you can write down PB. That's a very simple trick. PB. PB. So we are going to discuss whole thing by PB. P for the chronic lead poisoning is known as plumbism. P for chronic lead poisoning is known as plumbism. But apart from plumbism, you can get a word saturenism. Chronic lead poisoning is known as plumbism or saturenism. Okay. So this I discussed, chronic lead poisoning. It is known as either plumbism or cetirizism. P, here I'm writing down P, yes. Or here I'm writing down B, P and B, PB. Okay. Now what are the questions you can get in your exam? Sir, everyone knows that lead inhibit the heme synthesis. So very important, earliest and most consistent symptom of lead poisoning is facial pallor. Earliest and most consistent symptom of lead poisoning is facial pallor. Face become pale. B, Burtonian line are, my dear friend, blue line on gums. B, Burtonian line are blue line on gums. So we have discussed the B also. P, plumbism is a chronic lead poisoning or cetirizism is a chronic lead poisoning. B, Burtonian line are blue line on gums. Another B, basophilic stippling, my dear friend. Another B, basophilic stippling. What is basophilic stippling, sir? These are blue dot in RBC. These are blue dot in RBC. This is known as basophilic stippling. Now, Dr. Saab, what is the Dr. Saab? P is pallor. B, Burtonian line, blue line on the gums. B, basophilic stippling. Earliest and most consistent symptom is facial pallor. Most common route by which it goes in your body, it's an inhalation. Most common route by which it goes in your body is inhalation. Okay, Dr. Saab, this is basophilic stippling. Yes, as you can see. And this is Burtonian line. Both are given. Burtonian line and both are. But sir, basophilic stippling is not in basophil. It is in RBC. It is in RBC. Now, sir, lead poisoning causes diarrhea or constipation. This question comes in exam. Lead poisoning causes constipation. And Dr. Saab, 2 questions of the biochemistry I'm picking here. Lead inhibits which enzyme of the heme synthesis? Because I used to teach in biochemistry both enzyme. The number 1 is ferrochelatase. The number 1 enzyme is ferrochelatase. Number 2 enzyme is ALA dehydratase. Number 1 is ferrochelatase. Number 2 is ALA dehydratase. And there is one more enzyme, that is a coproporphyrinogen oxidase, which is also inhibited by lead, but I'm not thinking about that question. Ferrochelatase and ALA dehydratase are 2 enzymes which are inhibited by lead. Now, Doctor, we can write down LEAD. 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 What's the chelating agent? LEAD. Yes. DMSA, which in short it is known as succimer. LEAD, DMSA, and the second is EDTA. DMSA and EDTA are very, very important chelating agent. DMSA and EDTA are very, very important chelating agent. How would you remember, sir? LEAD, EDTA, DMSA. DMSA. Very, very simple. DMSA, EDTA. Okay. Now, Dr. Saab, I'm coming to phosphorus. Now, sir, I told you to remember the lead, PB, to remember the arsenic, ARIC. That's a very simple trick. Fatal dose of arsenic, I told you. But, sir, how would you remember phosphorus, sir? Dr. Saab, a very simple trick for phosphorus. First, I'll discuss the red phosphorus. Whenever you see the red signal, everything becomes no, no, no. Red phosphorus, non-toxic. Red phosphorus, no smell. Red phosphorus, non-luminous. So whenever you see the red signal, you say no, no, no. Non-toxic, no smell, non-luminous. White plus red combination, this is known as yellow phosphorus. White plus red combination, this is known as yellow phosphorus. So what is yellow phosphorus? White plus red combination, it is yellow phosphorus. But sir, red is everything no. White is everything yes. White is toxic. So fatal dose of white phosphorus is 60 to 120 milligram. Sir, white phosphorus shows garlicky smell, very, very potential MCQ. And Dr. white phosphorus is luminous also. That's why, my dear friend, white phosphorus is also known as Diwali poison. White phosphorus is luminous also. White phosphorus is also known as Diwali poison. Fatal dose is 60 to 120 milligram. Smell is garlicky. White phosphorus is also known as Diwali poison. Dr. Saab, why it is known as Diwali poison? Because it is used for making crackers. अभी जो पटाखे चल रहे हैं, तो पटाखे जो फोड़ रहे हो, पटाखे जो देख रहे हो, या पटाखे जो बजा रहे हो, Dr. Saab, this is white phosphorus. Dr. Saab, see, by this I can remember few MCQ. K, crackers has a K. Vitamin K is used in the treatment. A is astraxis. The tremor of the white phosphorus is known as astraxis. C, antidote for phosphorus is C for copper sulfate. So again, I'm revising. Fatal dose is 60 to 120 milligram. Smell is garlicky. Vitamin K is used in the treatment. A, astraxis are tremor. Antidote is copper sulfate. And observe, phosphorus has a necrosis of jawbone. Phosphorus has a necrosis of jawbone. It is phosijo. White phosphorus I'm talking about. Red, everything is no. White, everything is yes. Diwali poison. 60 to 120 milligram is a fatal dose. Cracker K, vitamin K, A, astraxis. Copper sulfate is antidote. So one question comes in exam. Which is a antidote as well as a poison? Yes, sir. Copper sulfate is an antidote of white phosphorus, but itself it's a poison. Copper sulfate is an antidote of phosphorus, but it's also a poison. This question comes in exam. And I already told you, what is a phosijo? Necrosis of jawbone is caused by white phosphorus. Now, sir, C for copper, C. So I'm telling you few tricks, very simple. C for copper, it forms kleptone line on gums which are green color. Kleptone line on gums which are green color. So first C is done. Second C, the chelating agent of copper is penicillamine. Actually, it is not starting with C, but it is having C. It's a penicillamine is a chelating agent. Sir, third C, cyanide is an antidote, but sir, it is not a cyanide. It is potassium ferrocyanide is an antidote. And observe, copper causes which disease? Vineyard, sprayer, lung disease is caused by copper. Vineyard, sprayer, lung disease is caused by copper. So again, I'm revising. C for copper, C for kleptone line, green line on the gum. C for silamine, penicillamine is a chelating agent. C for potassium ferrocyanide is an antidote, and it causes vineyard, sprayer, lung disease. It causes vineyard, sprayer, lung disease. So I told you all the trick to remember copper. Now, sir, come to the mercury. Everyone knows that mercury is known as Hg. So first I'll come to M. First alphabet M. M. Then next alphabet E. Then mercury is known as Hg. Then the shake is known as Hg. So M is done, E is done, Rc, mercury, Rc. So see what I want to tell you. M for mercury. In Japan, there was a Minamata disease because of mercury consumption. There was a Minamata disease in Japan due to mercury consumption. I M, again M. Mercuria lentis. Mercury deposition in mercury deposition in anterior lens capsule, it is Mercuria lentis. Mercury deposition in anterior lens capsule, it is Mercuria lentis. Sir, psychiatric problem in mercury poisoning. In this psychiatric problem, person becomes shy and depressed. Person becomes shy and depressed. It is erethism. It is erethism. So M is done Minamata in Mercuria lentis in anterior lens capsule. E is done psychiatric problem. So now the chronic mercury poisoning. Chronic mercury poisoning is known as hydragyrism. Chronic mercury poisoning is known as hydragyrism. Chronic mercury poisoning, it is known as hydragyrism, Hg. Sir, in mercury poisoning, you have Hatter's shake and you have glass blower shake. In mercury poisoning, you have Hatter's shake and glass blower shake. It is common in glass industry. RC. Mercury causes acrodynia, which is known as pink disease or Swift disease. Acrodynia, RC, CR, it is pink disease or Swift disease. Here you have pink, painful limbs. Here you will have pink, painful limbs. MME, erethism, HG, hydragyrism, HG, Hatter's shake and glass blower shake. Acrodynia is known as pink disease or Swift disease. Here you will have pink, painful limbs. Now, sir, two things. In mercury, you have Danbury tremor. The chelating agent of mercury is BAL. And my dear friend, antidote is sodium formaldehyde. Antidote is sodium formaldehyde sulfoxylate. Sodium formaldehyde sulfoxylate. M, Minamata. M, Mercuria lentis. E, erethism. Hg, hydragyrism. Hg, Hatter's shake and glass blower shake. Tremor, Danbury tremor. Acrodynia is a pink disease or Swift disease, pink painful limbs. Chelating agent are BAL. BAL is a chelating agent, my dear friend. And sodium formaldehyde sulfoxylate. Sodium formaldehyde sulfoxylate, it is the antidote. Chelating agent is BAL. Doctor, arsenic we remembered by arsenic, ARIC. PB, plumbism. Lead we remember by lead. Phosphorus, red is everything is no, white is everything is yes. And mercury, MERC, HG, we remembered everything. Very, very important. Sodium formaldehyde, etc. So if you get a question, the ideal suicidal agent is cyanide. Cyanide is not easily available. So most commonly used suicidal agent is insecticide. Ideal suicidal agent is cyanide, but cyanide is not easily available. So most commonly used suicidal poison in India is insecticide. And Aksar, in insecticide, the first is organophosphorus. Ideal suicidal agent is cyanide. Most commonly used suicidal agent is insecticide. It is organophosphate. Doctor, organophosphate is a phosphate. Smell should be garlicky phosphate. No, no, no. The only exception, sir. The smell of organophosphate is kerosene-like smell. The smell of organophosphate is kerosene-like smell. Ideal suicidal agent is cyanide. Most common used suicidal agent is insecticide. What is the smell of organophosphate? It is kerosene-like smell. Doctor, organophosphate inhibits the enzyme acetylcholinesterase. Organophosphate inhibits the enzyme acetylcholinesterase. So the effect will be cholinergic. And you can remember the cholinergic effect by BSC. Very simple. BSC. Like you remember dumbbell, but no need to remember the dumbbell that much. B for bradycardia. S for all secretion of the body are increased. And C for constriction of pupil. That's a very simple trick. BSC, bradycardia. All secretion of the body are increased and constriction of pupil. That's the organophosphorus. And Oxal, all secretion of the body, lacrimation, urination, defecation, whatever. Sir, because of increased secretion, there is one very important word which is known as red tear, chromolacrimoria. You can get a question, red tear or chromo. Chromo is a pigment in lacrimal gland, chromolacrimoria. Dr. Saab, investigation of choice is RBC cholinesterase. One very important MCQ comes in exam, that investigation of choice for organophosphorus is RBC cholinesterase. RBC cholinesterase, investigation of choice, not plasma. Just remember it's a RBC cholinesterase. No smell, garlicky, it's a kerosene smell, my dear. Or always remember it's a kerosene smell. Sir, antidote for organophosphorus, everyone knows it is atropine. Second is pralidoxime, my dear friend. Pralidoxime is palm, my dear friend. Second is pralidoxime, which is palm. What is an antidote of choice? It is atropine. Second is pralidoxime, which is palm. Investigation of choice is RBC cholinesterase. Very, very potential. Sir, alkyl phosphate are malathion. Alkyl organophosphorus is of two types, alkyl or aryl. So how would you remember malathion is alkyl? You just remember a trick, malaika, mala, alka, alkyl phosphate. Aryl phosphate are parathione and digenone. Alkyl phosphate are malathion. Aryl phosphate are parathione and digenone. What's the investigation of choice? RBC cholinesterase. What are the symptoms? BSC. What's the antidote of choice? Atropine. Second, pralidoxime. Malathion is the alkyl phosphate. Aryl phosphate are parathione and digenone. Smell is kerosene. तो डॉक्टर साहब कभी भी ब्रेडिकार्डिया, इंक्रीज सिक्रीशन, कॉन्स्ट्रिक्शन ऑफ प्यूपिल एंड केरोसिन लाइक स्मेल इज गिवन, तो आप केरोसिन पॉइजन पिक मत कर लेना, इट्स ऑर्गेनोफॉस्फोरस. द नेक्स्ट इंसेक्टिसाइड इज सेल्फोस, which is known as ALP3. Selphos is ALP3. The smell of the selphos is garlicky. Dr. Saab, it has phosphide, aluminium phosphide, smell is garlicky. Only phosphide where is no garlicky smell is organophosphorus. Sir, it inhibits the enzyme cytochrome oxidase. Fatal dose is 1 to 3 tablet. No specific antidote. Dr. Saab, देखो, organophosphorus inhibits acetylcholinesterase, it inhibits cytochrome oxidase. Organophosphorus smell is kerosene, its smell is garlicky. Both are insecticide. Organophosphorus specific antidote is atropine and pralidoxime. Here no specific antidote. And the fatal dose of selphos is a very, very potential MCQ. It is 1 to 3 tablet. Doctor, as I told you, a very, very simple, sir, my dear friend. Ideal suicidal poison is cyanide. Most commonly used in insecticide, and in insecticide it is organophosphate. Now, sir, come to asphyxiant gas. Asphyxiant gas which causes asphyxia, or you can use a word suffocation. Sir, first is carbon monoxide. Everyone knows, and this is a very important MCQ of the physiology. I don't know whether you know or not. Carbon monoxide combined with the hemoglobin. So the hemoglobin which is carrying, I used to teach this in physiology, hemoglobin which is carrying oxygen, that is less. So carbon monoxide, it causes anemic hypoxia. It causes anemic hypoxia because the hemoglobin will be less. Doctor, what is the treatment of carbon monoxide? Very, very important, sir. Hyperbaric oxygen is a treatment of carbon monoxide. Answer, we use one vitamin, that is a vitamin E. So hyperbaric oxygen and vitamin E is used in carbon monoxide poisoning because it is leading less oxygen. So hyperbaric oxygen and vitamin E are used in carbon monoxide. I already told you yesterday, if you die due to carbon monoxide poisoning, the color of the postmortem staining, it will be cherry red. So, carbon monoxide causes which hypoxia? Not histotoxic. The answer is anemic hypoxia. Sir, H2S, hydrogen sulfide, it is known as sewer gas. गटर में पाई जाने वाली गैस, गौतम नगर के नाले की गैस. डॉक्टर साहब, the smell of H2S is rotten egg smell. A very, very potential MCQ came in the last few exams. Rotten egg smell. In Japan, there was a detergent suicide. In that suicide, H2S gas was produced and postmortem staining color. Yesterday I told you H2, two color, bluish green. It is a sewer gas. Gutter में पाई जाने वाली gas है. Rotten egg smell, it is seen. In Japan, there was a detergent suicide. In that detergent suicide, H2S was produced and the postmortem staining color is blue-green. How would you remember? Two color, blue-green, blue-green. H2S. Two color, blue-green. Japan, there is a detergent suicide. Sir, cyanide is also known as prussic acid. Cyanide is also known as prussic acid. Bitter almond smell. The smell of the cyanide is bitter almond smell. It inhibits cytochrome oxidase. Smell of the cyanide is bitter almond smell. It inhibits cytochrome oxidase. So, my dear friend, it causes histotoxic hypoxia. It causes histotoxic hypoxia. I already told you, sir, smell of the cyanide is bitter almond. It causes histotoxic hypoxia, inhibits cytochrome oxidase. Postmortem staining color is brick red. This you can get a question. Antidote is vitamin B12. Vitamin B12. Vitamin B12 in cyanide, vitamin K in phosphorus, vitamin E in carbon monoxide, vitamin B1 in coma cocktail. Hydroxycobalamin is a vitamin B12. Now, sir, cyanide can also be present in apple seed. Be careful, sir. Don't eat apple seed, my dear friend. Cyanide can also be present in apple seed. The apple seed can cause cyanide toxicity. Dr. For cyanide, we use Lilly antidote. Lilly antidote is a triple antidote, my dear friend. Lilly antidote is a triple antidote. What is this triple antidote? Amyl nitrite. It is amyl nitrite. It is amyl nitrite. It is sodium nitrite and sodium thiosulfate. Three antidote. Amyl nitrite is used as an inhalation. Amyl nitrite is used as an inhalation. Sodium thiosulfate causes cyanide to be excreted in urine. Yes. Sodium thiosulfate causes cyanide to be excreted in urine. Amyl nitrite, sodium nitrite, and sodium thiosulfate is a triple antidote. Apple seed contains cyanide. It can cause cyanide poisoning. Cyanide causes histotoxic hypoxia. Anemic hypoxia, carbon monoxide. Histotoxic hypoxia, cyanide. Lee, Dr. Saab, cyanide ne aapki ली, for cyanide we do a test, Lee-Jones test. For cyanide we do a test, Lee-Jones test. Antidote is Lilly antidote. Vitamin B12 is a antidote. Very, very specific antidote. Now, sir, अब हम बात करते हैं शराब की, sir. CNS depressant. Don't drink much alcohol. Ethanol, sir, because ethanol is a CNS depressant. Dr. Saab, if male and female are consuming same amount of alcohol, female alcohol, blood alcohol will be high. The reason is In female, the metabolizing enzyme is less. In female, the metabolizing enzyme is less. So female blood alcohol will be higher than the male in the same amount of alcohol. Sir, 90% ethanol. 90% ethanol is in rectified spirit. 95% ethanol in denatured spirit, and 99.95% ethanol in absolute alcohol. Rectified spirit 90%, denatured spirit 95%, and absolute alcohol content 99.95%. Dr. Saab, if you are driving in India, your alcohol should not exceed 30 milligram percentage. It's a driving limit. It's not 30 ml. It's a 30 milligram percentage of the blood alcohol concentration. At 80 milligram percentage, your eyes start bubbling. It is known as nystagmus. At 150 milligram percent, you have the motor incoordination. You start bubbling. Driving limit 30 milligram percentage. Nystagmus 80 milligram percentage. Motor incoordination 150 milligram percentage. Dr. Saab, coma and death 300 to 400 milligram percentage. Very, very simple, sir. C, coma, third alphabet, 300, death at 400 milligram percent. Dr. Saab, if after alcohol drinking, you misconduct with any person, there will be 510 IPC. अगर शराब पी के आपने किसी के साथ बदतमीजी की तो आप पे 510 पंजा और 10 साल लगेगा. 510 IPC. Very, very important, sir. Which is the best test for alcohol estimation? It is gas chromatography. The best test for alcohol estimation, it's a gas chromatography, best test. For alcohol estimation, we use a formula which is known as Widmark formula. Sharab pee ke badtamiji 510 IPC. Best test for alcohol estimation is gas chromatography, and there is a formula which is known as Widmark formula. And Dr. This question also comes in exam. Maximum absorption of alcohol is from small intestine. Maximum absorption of alcohol, it is small intestine, my dear friend. Yes or no? It is small intestine. Gas chromatography is the best test. Widmark formula is this for alcohol, and maximum absorption of alcohol is small intestine. Yes or no, my dear friend? Methanol. Sir, methanol is present in adulterated liquor. Methanol is present in adulterated liquor. And Dr. Remember, adulterated means nakli sharab. And this nakli sharab can cause hooch tragedy. This nakli sharab can cause hooch tragedy. Methanol can be present in adulterated liquor. जिसमें आपने नकली शराब, I'm not talking about the देशी शराब. देशी शराब has ethanol. नकली शराब, methanol mixed. It's a huge tragedy. The fatal dose of methanol is 80 to 120 ml. 80 to 120 ml. And Dr. in this nakli sharab, we have snow-filled vision. Snow-filled vision. And Dr. because it attacks on retina, it can cause blindness. The treatment of choice for methanol is hemodialysis. So again, I'm revising all the points, sir. Listen carefully. It causes hooch tragedy. Nakli sharab. What's the dose? Fatal dose of methanol, 80 to 120 ml. It causes snow-filled vision or blindness. The treatment of choice for methanol is hemodialysis. Snow-filled vision, blindness. Sir, antidote of choice for methanol is ethanol. Antidote of choice for methanol is ethanol. And second antidote of choice is fomepizole. Again, I'm revising, my dear friend. Antidote of choice for methanol is ethanol. Second antidote of choice is fomepizole. Treatment of choice is hemodialysis, snow-filled vision or blindness. And what's the name of the tragedy? Which tragedy? What's a fatal dose? It is 80 to 120 ml. Doctor, I told you ideal suicidal poison is a cyanide, and most commonly used suicidal poison is insecticide. Now come to ideal homicidal poison, sir. Sir, ideal homicidal poison is thallium, my dear friend. And remember, my dear friend, thallium has skin rashes. Thallium has painful polyneuropathy. Painful polyneuropathy. And thallium has a hair loss, which is, I can write down, alopecia, like lateral side of the eyebrows are also lost, alopecia. And Dr. Saab, you can remember thallium also has meseline. Thallium also has meseline like arsenic. Skin rashes, painful polyneuropathy, alopecia, and meseline. Dr. Saab, thallium is an ideal homicidal poison. But sir, again the same problem comes. Thallium is not easily available. If thallium is not easily available, the most commonly used homicidal poison is arsenic or aconite. Most commonly used homicidal poison is arsenic and aconite. Most commonly used homicidal poison is arsenic or aconite. Thallium has a meseline. Thallium has a skin rashes. Thallium has painful polyneuropathy, and thallium causes alopecia. But it is not easily available. Most common homicidal poison is arsenic or aconite. Most common method of suicide in India. Yesterday only I told you it's a hanging. It's a painless method. But sir, what is the most common method of parasuicide? Parasuicide is an attempted suicide. Parasuicide is a attempted suicide, my dear friend. And most common method of parasuicide is either drug or poison. Most common method of parasuicide is either drug or poison. Again, I'm revising. Meseline, skin rashes, painful polyneuropathy, or alopecia are caused by thallium. Most common homicidal poison are arsenic or aconite. Most common method of suicide in India is hanging. And most common method of parasuicide, attempted suicide, is drug or poison. Dr. Saab, corrosive, two type of corrosive where we have acid or alkali. Acid has C. So it's a very simple trick. Acid causes C for coagulative necrosis. Alkali has Li. Alkali has Li. It's a liquefactive necrosis. Acid has C. Acid has C. It causes coagulative necrosis. Alkali has Li. It causes liquefactive necrosis. Now, first acid I'm coming to Bo. Sir, Bo for boric acid. Bo for it causes boiled lobster syndrome. That's a very simple thing you can keep. Bo causes Bo. Bo for boric acid, it causes boiled lobster syndrome. Bo. दोनों को combine मत कर देना. Acid causes coagulative necrosis. Alkali causes liquefactive necrosis. Alkali are more dangerous. Alkali are more dangerous. Sir, nitric acid is also known as Aqua Fortis, and it is known as Tejab. Nitric acid is also known as Aqua Fortis, and it is known as Tejab. Aqua Fortis or Tejab. Dr. Saab, symptom of the nitric acid, you can get this question in your exam. Nitric acid is also known as Aqua Fortis or Tejab, the symptom of nitric acid is brown color urine. Boric acid causes boiled lobster syndrome. Acid C, coagulative necrosis. Alkali, liquefactive necrosis. Sir, in nitric acid, the tissue become yellow color. In nitric acid, the tissue become yellow color. And my dear friend, tissue become yellow color. This is known as xanthoprotic reaction. This is known as xanthoprotic reaction, a very, very potential MCQ. Xanthoprotic reaction is seen in nitric acid. Here, tissue become yellow color. XANTHO PROTEIC, xanthoprotic reaction. Brown color urine and xanthoprotic reaction are seen in nitric acid. Oxalic acid, you can write down all C. What are these C? First, oxalic acid, this is not C. Oxalic acid use is, it is used as an ink remover. So you can remove first C. First is not a C. The use of oxalic acid is ink remover. Use of the oxalic acid is ink remover. What it forms in your body? It forms calcium oxalate. It forms calcium oxalate. So because it forms calcium oxalate, it causes hypocalcemia. The free calcium will be decreased. Calcium gluconate is an antidote. Chalk powder is an antidote. Calcium gluconate is an antidote. Chalk powder is an antidote. And sir, even your wall scraping, very, very potential MCQ. Even you use wall scraping contain your calcium. That is also an antidote. And the last C, coffee ground vomiters. All are C. First, what is the use of oxalic acid? It is used as an ink remover. Yes. What it forms? C, calcium oxalate. C, it decreases calcium, hypocalcemia. Antidote, calcium gluconate. C, chalk powder. Wall scraping. So this question has come in MCI. Wall scraping is used to treat which poisoning? Oxalic acid. And C, coffee ground vomiters. Everything is C. That is oxalic acid. Now, sir, again come to C for carbolic acid. Sir, C for carbolic acid, constriction of pupil. C. Sir, another C, it is deposited in the cartilage. It is deposited in the cartilage. It is known as ochronosis. Another C, carboluria. The green color urine is known as carboluria. So again, I'm revising, my dear friend. C for carbolic acid. C for constriction of pupil. C for cartilage में deposit हो जाता. This is known as ochronosis. Dr. One ochronosis we used to discuss in biochemistry. In alkaptonuria, homogenticide oxidase deficiency. That's a different one. But it is also deposited in the cartilage known as ochronosis. And the green color urine is known as carboluria. C. Dr. Saab, carbolic acid is also known as phenol. Everyone knows. So phenol is an antiseptic. If you died due to phenol poisoning, decomposition is delayed. C, carbolic acid. C, constriction of pupil. C, it is deposited in the cartilage. It is known as ochronosis. And C for, it is carboluria. The green color urine is seen in this. Yes or no, my dear friend? And Aksar, it is very simple. It is also known as phenol. So if you die due to phenol poisoning, decomposition is delayed. Decomposition is delayed. Aksar, this I already discussed. Leathery mucosa is in carbolic acid, and we can go for gastric lavage. C. Leathery mucosa present in carbolic acid, we can go for gastric lavage. Now come to, sir, strongest acid which is known as sulfuric acid. Strongest acid, which is known as sulfuric acid. So the mucosa become leathery, gastric lavage can be done. What is the name of strongest acid? The strongest acid is sulfuric acid. Strongest acid is sulfuric acid. So sulfuric acid is also known as oil of vitriol, my dear friend. Sulfuric acid is also known as oil of vitriol. Sulfuric acid is also known as oil of vitriol. The fatal dose is 5 to 10 ml. And the fatal period is 15 to 20 hours. That's a very simple trick. 5, 10, 15, 20. The fatal dose is 5 to 10 ml. Fatal period is 15 to 20 hours. The very simple trick is 5, 10, 15, 20. Sir, antidote for sulfuric acid is magnesium oxide. Sir, in sulfuric acid, the mucosa and organ become black. Mucosa and organ become black. This is known as blotting pepper mucosa. It is a oil of vitriol. It is a oil of vitriol. Fatal dose is 5 to 10 ml FD. Fatal period is 15 to 20 hours. Strongest acid is sulfuric acid. Antidote is magnesium oxide. Mucosa and organ become black. It is known as blotting pepper mucosa. And my dear friend, chalky white teeth. It is chalky white teeth. It is seen, my dear friend. Dr. Saab, most common vitriolase is called, vitriolase I already told you, acid throwing, and I told you 2 IPC, 326A and 326B. My dear friend, most commonly vitriolase is by sulfuric acid. And Dr. Saab, leathery mucosa, carbolic acid. Red velvety mucosa, arsenic. Blotting paper mucosa is sulfuric acid. Dr. Saab, most commonly vitriolase is caused by sulfuric acid because it's the strongest acid. Teeth become this chalky white. Okay. Most common plant causing vitriolase. This question also comes in exam. It is semicarpus, and the second is calotropis. Again, I'm telling you, my dear friend, most common plant causing vitriolase is semicarpus. Second is calotropis. A strongest acid associated with vitriolase is sulfuric acid. Mucosa and organ, it's a blotting paper mucosa. Teeth is chalky white, and strongest acid is sulfuric acid. Strongest acid is sulfuric acid. Very, very important one. Now, Dr. we are taking a short break of 25 minutes. It's 12:27 right now. So we'll meet at 12:52. 25 minutes break. It's 12:52. Blotting paper mucosa, chalky white teeth. Most common acids, it is sulfuric acid, and most common plant which causes vitriolase, it's a semicarpus. Second is calotropis. Second is calotropis. So we'll discuss, we'll meet at 12:52. We have discussed the sulfuric acid is most commonly used for vitriolase, and the most common plant which is causing vitriolase, it is Semicarpus. It is Semicarpus. Now I am coming to the plant which is CNS stimulant, my dear friend. The plant which is CNS stimulant. Okay, dear friends. So we are coming to the next poison, the plant which is CNS stimulant. The plant which is CNS stimulant is cannabis. Dr. Saab, the main component of cannabis is 9-tetrahydrocannabinol. 9-tetrahydrocannabinol. It's a cannabis. Dr. Saab, the most potent 9-tetrahydrocannabinol is cannabis component. The most potent is charas. Sir, charas is a resin, and it is either from stem of the cannabis and from leaves of the cannabis. So it is charas is either from stem or leaves. It's a resin. C. Antidote is diazepam. Sir, the whole part of the cannabis are excitatory. Whole part of the cannabis is excitatory. The female flower is used for making ganja. So charas is by resin. Female flower is used for making ganja. The cigarette of ganja, it is known as reefer. The cigarette of ganja, it is known as reefer. After cannabis, there is a homicidal tendency. This question comes in exam. This is known as run amok. It's a mainly homicidal tendency. Bhang is prepared from dry leaves. Dekho, charas is a resin. Ganja is a female flower. Bhang is from dry leaves. The cannabis smell are burnt rope smell. The smell of cannabis product are burnt rope smell. This is very potential MCQ. Burnt rope smell is seen in cannabis. Hashish and charas both are seen. Hashish and charas both are seen. The sweet product is also known as majun. The sweet product is also known as majun. And remember, my dear friend, the commonly used name for cannabis is marijuana. The commonly used name, the street name for cannabis, we use marijuana. Majun is a sweet product. ऐसे याद कर सकते हो, मजनू मीठे होते हैं. Reefer is a cigarette of ganja. Resin is a charas. Bhang is a dry leaves. And what is the smell of the cannabis product, sir? The smell of the cannabis product is, it is burnt rope smell. Sir, ऐसे याद कर सकते हो, रस्सी जल गई, cannabis नहीं गया. This is cannabis plant, my dear friend. So this is a CNS stimulant. CNS depressant is alcohol. This is a run amok, majun meethe hote. Sir, strychnine. Sir, strychnine is also known as Nux vomica. And another name of strychnine is Cuchilla. The strychnine is also known as Nux vomica. Another name is Cuchilla. Sir, it affects spinal cord, and in spinal cord, it affects anterior horn cells. It affects spinal cord, and it affects anterior horn cell spinal cord, my friend. Dr. Saab, what is a fatal dose of strychnine? Fatal dose of strychnine is 1 crush seed. Fatal dose of strychnine is 1 crush seed. So 1 crush seed is fatal dose. It causes respiratory muscle paralysis. It causes respiratory muscle paralysis by clonic or tonic position. By clonic or tonic position, it causes respiratory muscle paralysis. Sir, it look like a disease. It mimic a disease which is tetanus. So which disease? I told you mimic cholera, acute arsenic poisoning. Nux vomica or Kuchila, spinal cord anterior horn cell. Fatal dose is 1 crushed seed. It causes respiratory muscle paralysis, clonic and tonic position of the body. So the most common position of the body, it is opisthotonus. The most common position of the body, it is opisthotonus. It is hyper extension of back. Hyperextension of the back. This condition is known as opisthotonus. 1 crushed seed is a fatal dose. Clonic tonic position. It look like a disease. What's the name of the disease? Look like tetanus. It causes opisthotonus. Most common position of the body is opisthotonus. Hyperextension of the back. Doctor, you can see the seed hyperextension of the back. The seed of strychnine, my dear friend, it doesn't look like RBC. The seed of strychnine are just like subdural hematoma, concavo-convex. So I told you subdural hematoma is a concavo-convex. S for strychnine is concavo-convex. And of such, strychnine is used to kill dogs. Strychnine is used to kill dogs. That's why it is known as dog button. The strychnine is used to kill dogs. That's why strychnine is also known as dog button. It is used to kill dogs. That's why strychnine is also known as dog button. Concavo-convex seed. Dog button. Dog button. So it's a concavo-convex seed, strychnine. Now I am coming to the cardiac poison, my dear friend. The first cardiac poison is monkhood. Monkhood is also known as aconite. Monkhood is also known as aconite. Sweet poison, meetha zahar. Sweet poison, meetha zahar, or blue rocket. These are 4 names for cardiac poison. Number 1, monkhood. Monkhood is known as aconite. Monkhood is known as aconite, sweet poison, or blue rocket. And my dear friend, this is the blue rocket. It is looking like a blue rocket. That's why it is known as blue rocket. What are the name of the cardiac poison? Monkhood, aconite. And I'm just giving you the homework. Just see the root of aconite in Google today, because sometimes the root can come as a question of aconite. It's a brown color root. Aconite, monkhood, sweet poison, blue rocket, all are same. Sir, in aconite poisoning, we have a classical sign, Hippus sign. What is Hippus sign? Alternate contraction and dilation of the pupil. Alternate contraction and dilation of the pupil. This is known as Hippus sign. Again, I'm telling you, monkhood, aconite, sweet poison, or blue rocket. There is an alternate contraction and dilation of the pupil. This is known as Hippus sign. So this is the first cardiac poison: monkhood, aconite, sweet poison, blue rocket, meetha zahar. Sir, the second cardiac poison is yellow oleander. Sir, yellow oleander, in Hindi it is known as pila kaneer. Yellow oleander, in Hindi it is known as pila kaneer, cerebra. So, it's a very simple trick. The toxin is cerebrine. This question comes in exam. It is cerebra, yellow oleander, pila kaneer. The toxin is cerebrine. This image also comes in exam. So cerebra. Doctor, the full name is cerebra thivacea. So there will be toxin cerebrine or thivacine. There will be toxin cerebrine and thivacine. तो सब this is पीला कनेर, हिंदी में बोलते हैं हम पीला कनेर, yellow oleander, cerebra thivacea. The toxin are cerebrine or thivacine. The toxin are cerebrine or thivacine. Now I am coming to the white oleander, saped kaneer. It is known as nerium and the toxin is nerine. It is known as nerium. The toxin is nerine. ऐसे याद कर सकते हो नीर, नीर इज ए पानी, पानी का कलर व्हाइट होता है, दैट्स a trick you can remember. It is सफेद कनेर. It is सफेद कनेर. सफेद is a white kaneer. It's a white oleander, saped kaneer. The toxin is nerine and the botanical name is nerium, my dear friend. So, the botanical name is nerium, the toxin is nerine. I will show you the picture of saped kaneer because you all know this. This is a white oleander, nerium or nerine. White oleander, nerium or nerine. So, I have told you 3 cardiac poison: aconite, blue rocket, meetha zahar, monk wood, hippocine, done. Yellow oleander, cerebra thivacea, cerebrine and thivacine. This is the picture. White oleander, nerium. The toxin is nerine. It's a saped kaneer. It is a saped kaneer. नीर का मतलब पानी, पानी आपका लगभग white होता है. डॉक्टर साहब, the next cardiac poison is Nicotina tobacum. Nicotina tobacum produces tobacco. Nicotina tobacum produces tobacco, and this question comes in exam. Most common substance used and abused in India is tobacco. Most common substance used and abused in India is tobacco. Very, very potential MCQ. Dr. Saab, but if the question comes, most common illicit substance used and abused in India, sir, illicit means illegal. If illegal word comes, the answer is cannabis. Again, I'm telling you, 2 different MCQ. Most common substance used and abused in India is tobacco. But if the question comes, most common illicit substance used and abused in India, the answer is cannabis. Most common substance used and abused in India is tobacco. Most common illicit substance used and abused in India is cannabis. Dr. Saab, D for datura, D for it causes delirium. Dr. Saab, if it causes delirium, my dear friend, you go in delirium, a altered sensorium. That's why, sir, it is the most common roadside or most common railway side poison. It is most common roadside or railway side poison. R for roadside, R for railway side, R for it is used for robbery because you go in delirium and the whole things are lost. It is used for robbery. Dr. Saab, it is a 9D poison. There are 9D as a symptom. There are 9D as a symptom. And Dr. Saab, this question comes in exam. The first symptom is dryness of mouth. The first symptom is dryness of mouth. And as I'm telling you, my dear friend, it's an anticholinergic. It is anticholinergic. The 2 main anticholinergic of this plant are atropine and hyoscine. The 2 main anticholinergic of the plant are atropine and hyoscine. D, datura, D, delirium, D, 9D poison. First symptom is dryness of mouth. What are the 2 main anticholinergic? Atropine and hyoscine. Doctor, as I told you, because it causes delirium, it is most common roadside, railway side, or robbery poison. Strychnine fatal dose was 1 seed. Here, my dear friend, the fatal dose is 100 seeds. Very, very potential MCQ, my dear friend. Here, the fatal dose is 100 seeds. Fatal dose is 100 seeds. Doctor, it's anticholinergic. It causes mydriatic pupil. My dear friend, mydriatic pupil is known as corn picker pupil. Anticholinergic, it's a mydriatic pupil. Mydriatic pupil is known as corn picker pupil. It causes mydriasis. It's a mydriatic pupil. It is known as corn picker pupil. Dr. Sahab, Datura alba is a white Datura. Datura alba is a white Datura. Datura niger, this is Datura alba, white. Datura niger, fatal dose 100 seeds. Datura niger is a purple Datura. And my dear friend, Datura stramonium, this is Datura stramonium. It is known as thorn apple. And Dr. Sahab, these are Datura seeds. All the images comes in exam. Datura seed, black color seed. Datura alba, the white color Datura. Datura stramonium, that will be thorn. It is known as thorn apple. And Dr. Sahab, for Datura, the main antidote is physostigmine. The main antidote is physostigmine. And second antidote is pilocarpine. Alba is a white Datura. Niger is a purple Datura. Datura stramonium is a thorn apple. The main antidote is physostigmine and pilocarpine. The main antidote is physostigmine and pilocarpine. Seeds, Datura alba is a white Datura. Datura stramonium is a thorn apple. Datura stramonium is a thorn apple. It's a delirium plant, roadside poison, most common. Atropine and hyoscine, the first symptom is the dryness of mouth. And there is many D, drunkenness, drowsiness, dryness, diplopia, dysphagia, delirium, distress, death, many D. So now I'm coming to opium. Dr. Sahab, opium is also known as afim. And Dr. Sahab, one name you can remember, it is kasumba. Opium is also known as afim, and one name you can remember, it is kasumba. It is from unripe poppy fruit. See, this is a poppy fruit. It is from unripe poppy fruit. You give the vertical incision. I will show the image also, my dear friend. It is from unripe poppy fruit. This is Datura seed. This is white Datura. These are the unripe. We give vertical incision and we take afim out. This is poppy fruit. Sir, this is poppy seed, which are khaskhas, non-toxic. So I'm coming to one very, very important part. Poppy fruit by which we take opium out after giving vertical incision, afim or kasumba. But sir, poppy seeds are known as khas. Poppy seed are known as what, my dear friend? Khas. Dr. Sahab, poppy seed are khas. Poppy fruit, we give the vertical incision. It is known as opium or afim. Dr. Sahab, pupil. In opium toxicity, we have pinpoint pupil in comatose patient. The pupil become pinpoint in coma. And the antidote of opium is naloxone. Dr. Sahab, even in forensic medicine, you will get 5 to 6 questions of the pharma from my forensic notes. I'm 100% sure. Opium is a afim or kasumba. By unripe poppy fruit, we give the vertical incision and the afim is taken, opium is taken. Pinpoint pupil is seen in comatose patient. Antidote is naloxone, and the poppy seed are known as khas. Poppy seed are known as khas. Now, Dr. Sahab, I am coming to one product of morphine, which is a semi-synthetic product of dimorphine. It is a semi-synthetic product of morphine, which is a diacetyl morphine. So this question also comes in exam. What is diacetyl morphine? It is a semi-synthetic product of the morphine. Dr. Sahab, diacetyl morphine is also known as heroin, jung, dope, brown sugar, smack. Again, I am revising all the names. What are the other name of diacetyl morphine? Heroin, jung, dope, brown sugar, smack. Heroin, jung, dope, brown sugar, smack. This is a semi-synthetic product of the morphine. This is heroin, diacetyl morphine, jung, dope, brown sugar, smack. Sir, heroin plus cocaine heroin plus cocaine is known as speedball. Heroin plus cocaine, it is known as speedball. And heroin plus strychnine, my dear friend, HS. Heroin plus strychnine, it is known as hot shot. Heroin plus cocaine is known as speedball. Heroin plus strychnine, it is known as hot shot. Dr. Saab, the smoking the heroin method. Smoking the heroin method, it is known as chasing the dragon. So I will show you the picture, sir, how to smoke the heroin. You can see this is chasing the dragon, smoking the heroin method. This is known as chasing the method, chasing the dragon. So again, revising, heroin plus cocaine is known as speedball. Heroin plus strychnine is known as hot shot. And chasing the dragon is heroin smoking method. Very, very important. So this is brown sugar. Yes, the part of the heroin. This is brown sugar. Now, sir, what are, I told you the name of the heroin are junk, dope, brown sugar, smack. This is heroin. Sir, cocaine. What are the name of cocaine? Crack, coke, snow, crack, coke, snow, and the last name is white lady. Remember, what are the name of the cocaine? Crack. Yes, very, very important one. Crack, coke, snow, and white lady. The name of the cocaine are crack, coke, snow, and white lady. Crack, coke, snow, and white lady. Crack, coke, snow, and white lady. Sir, the name is white, but it causes everything black. Naam white lady saman sara kala karti hai. So the tongue and teeth become black, my dear friend. The tongue and teeth become black. Very, very important, sir. And Dr. Saab, in cocaine poisoning, nasal septal perforation is very, very common. That's why, sir, if you get a question, what is the preferable sample for cocaine poisoning? It's a nasal swab, nasal septal perforation. The preferable sample is nasal swab. Dr. Saab, the name is white lady, but it causes black tongue and black teeth. The antidote of cocaine, my dear friend, is amyl nitrite. Antidote of cocaine is amyl nitrite. And Dr. Saab, in cocaine, we have tactile hallucination. In cocaine, we have tactile hallucination. Dr. Saab, this tactile hallucination is known as Magnan symptom. Like this tactile hallucination in cocaine poisoning, it is known as Magnan symptom. And it is also known as cocaine bug. It is also known as cocaine bug. Crack, coke, snow, and white lady. Nasal swab is a sample. Antidote is amyl nitrite. And there is a Magnan symptom. What is Magnan symptom? The tactile hallucination. ऐसा लगेगा कि आपके skin पे कीड़े चल रहे हैं. The insects or the mouse is crawling on the skin. Tactile hallucination is also known as Magnan symptom or cocaine bug. Or cocaine bug. Doctor, what is a tactile hallucination in cocaine is known as, tell me dear, it's a Magnan symptom or cocaine bug. Now I'm coming to the irritant plant, my dear friend. This irritant plant, as you can in the slide, this irritant plant is castor seed, small, shiny seed, smooth seed, castor seed. So I'll come to that point, my dear friend. See, plant poison which are irritant. The first plant poison which is irritant, it is Ricinus. My dear friend, Ricinus is known as castor plant, and another name of Ricinus is Arandi. Very, very important, sir. Ricinus, I have shown you the seeds, small smooth seed. Ricinus is a castor plant. It is also known as Arandi, castor plant or Arandi. How many seeds are fatal dose? 10 seeds are fatal dose. Look, sub, 1 crushed seed strychnine, 100 seed datura, 10 seed is a fatal dose of Ricinus, and the main toxin for Ricinus is ricin. The main toxin for Ricinus is ricin. Sir, croton is also known as Napala, and another name of croton is Jamal Gota. Croton is known as Napala और जमाल गोटा. गोटा जब आप गोटा मारोगे तो चौका लगेगा. The fatal dose are 4 seeds. Croton is known as Napala. Croton is known as Napala. This is croton. It is Napala or Jamal Gota. जब आप घोटा लगाओगे तो चौका लगेगा. The 4 seed is a fatal dose. Croton is Napala or Jamal Gota. Ratti. Dr. Saab, Ratti is Ratti, rosary bead or abrus. Ratti, rosary bead or abrus, and another name is Gunja. Again, I'm revising, my dear friend. Ratti, rosary bead, abrus, and another name is Gunja. So 4 names you can see: Ratti, rosary bead, another name is Gunja. So this picture is also given in your booklet, but you can see why it is known as rosary bead. Rose ki tarah lal hote, like a rose, it's a red with black top. So it's very important, sir. Ratti, rosary bead, Gunja or abrus. So it's very simple. A for abrus, yes. Everything is A. A for fatal dose is A. A for 1 seed is a fatal dose. A. Sir, toxin name is Abrine, another A. And Dr. Abrine act like viper venom. Abrine act like viper venom. Another A, it is a animal poison. It is used to kill cattle by using sui or needle. A for abrus. A for fatal dose, 1 seed A. A for Abrine. Abrine acts like a viper venom. Abrine, mechanism of action is like viper venom. And A for animal poison, to kill animal, we use sui or needle. A. Another A, it's a arrow poison. Another A, it's a arrow poison. And another A, it's a abortion poison. A, abrus. A, 1 seed. A, animal poison. A, arrow poison. A, abrine. The mechanism of abrine is just like a viper venom. And A, it's an abortion poison. So everything is A without any doubt. Now, sir, how would you treat the animal? Sir, you will treat the animal after dissection of the sui. Then you will use anti-abrine. Then you will go for gastric lavage. So I'm telling you, sir, dissection of sui, sui को बाहर निकालोगे, anti-abrine दोगे, gastric lavage. ये है रत्ती, गुंजा, rosary bead, and abrus. Everything is A. Mechanism is just like a viper venom action. Dr. Saab, ergot is from a fungus. That fungus is claviceps. Ergot is from a fungus. That fungus is claviceps. This fungus is very, very common in rye plant. This fungus is very, very common in rye plant. Dr. Saab, this also causes tactile hallucination. Just remember, tactile hallucination is also known as formication. Dr. Saab, in cocaine poisoning, I told you tactile hallucination was Megnan symptom. But normally for tactile hallucination, we use a word formication. Like you can see the inflammation of the palm, tactile hallucination. It is caused by a fungus. What's the name of the fungus? Claviceps. And it is common in which plant? Rye plant. Ricinus castor arundi. Jamal Gota croton, 4 seed. Abrus Gunja, 1 seed. And fungus on rye plant claviceps produce ergot. It causes tactile hallucination. Tactile hallucination is also known as formication. Now, sir, a very, very potential word. Snake poisoning, my dear friend. Sir, snake, for snake we use a word ufio. For snake we use a word ufio. For poisoning we use a word toxemia. So study of snake poisoning is known as uphiotoxemia. Study of snake poisoning, it is known as uphiotoxemia. CO for cobra, CO for common kharid. Again, I'm telling you, my dear friend, CO for cobra, CO for common kharid, it causes CO for coma. So, cobra and common kharid, it causes coma. So one thing is clear, cobra and common kharid both are neurotoxic. Uphiotoxemia is study of snake poisoning. Co for cobra, co for common crate, co for coma. Doctor Saab, what is the fatal dose of common crate? It is 6 milligram. And what is the fatal dose of cobra? It's a 12 milligram. So Doctor Saab, fatal dose of cobra is 12 milligram. Fatal dose of common crate is 6 milligram. It means common crate is more poisonous. But sir, common crate is more poisonous, but more dangerous is cobra. The reason is amount of the poison is very high in cobra. And Doctor Saab, cause of death, very, very important, my dear friend. Cause of death for cobra and common crate both is respiratory muscle paralysis. Respiratory muscle paralysis. Sir, the zoological name of cobra is Naja naja, and the zoological name of common crate is Bengarus. Zoological name of the cobra is Naja naja, and the zoological name of common crate is Bengarus. 12 milligram, 6 milligram. More dangerous is cobra, more poisonous is common crate. Both causes coma, neurotoxic, and in both cause of death is respiratory muscle paralysis. Doctor Saab, I will show you the picture of this. This is cobra. Doctor Saab, you can identify the cobra by spectacle. This is spectacle. This is spectacle. Doctor Saab, I am coming to one more point. In the hood of cobra, spectacle present. Spectacle present. Why I am telling you, my dear friend? Because if you see one more cobra, which is known as king cobra, here spectacle absent. Doctor Saab, I will share this picture. This is cobra. This is common crate. Common crate is Bengarus. Cobra is Naja naja. Naja naja Bengarus. Naja naja Bengarus. Doctor Saab, in king cobra, spectacle is absent on the hood. The length of king cobra is more. The king cobra is more fatal than cobra. And Doctor Saab, the zoological name of king cobra is Ophiophagus. Doctor Saab, Ophiophagus. By this name, you can understand what I'm talking about. Ophio is snake. Phagus is eating. Doctor Saab, this king cobra also eats snakes. Doctor Saab, Ophiophagus is the zoological name of king cobra. Again, I'm telling you, my dear friend, spectacle in the hood present in cobra, which is absent in king cobra. The length of king cobra is more, fatality is more, and king cobra is Ophiophagus. What is Ophiophagus? Do you tell me? Ophiophagus means eating the snake. That is the name of king cobra. Naja naja is cobra. Bengarus is common crate. More poisonous is common crate, but more fatal is cobra. The most dangerous one is king cobra. All three are neurotoxic. Cause of death is respiratory muscle paralysis in all three snakes. King cobra, it's a more in length, no spectacle. Doctor Saab, V for viper, V for vasculotoxic. It causes hemolysis and hemorrhage and ultimately DIC. V for viper, V for vasculotoxic. That's very simple trick. V for viper, V for vasculotoxic. It causes hemolysis and hemorrhage and ultimately DIC. Doctor Saab, Russell viper and Sow-scale viper both has triangular head. Russell viper and Sow-scale viper both has triangular head. Doctor Saab, I will show you the picture. Yes, you can see. This is Russell viper, triangular head. It's a Russell viper, V for vasculotoxic, and this is Sow-scale viper. This is Sow-scale viper. So again, I'm coming to the point. Co-cobra, co-common crate, co-coma, neurotoxic. V viper, V for vasculotoxic, hemolysis, and this one. Now, Doctor Saab, I'm coming to anti-snake venom. Sir, anti-snake venom is prepared from cobra, from common crate, and by both viper, Russell viper and Sow-scale viper. It means that anti-snake venom is prepared from 4 snakes. Anti-snake venom is prepared from 4 snakes. What are these 4 snakes? Cobra, common crate, Russell viper, and Soskill viper. Anti-snake venom is for forest snake, cobra, common krait, Russell viper, and Soskill viper. Sir, anti-snake venom is prepared in Mumbai. It is prepared in Mumbai and in one institute, which is Hopkins Institute. One institute, which is Hopkins Institute. Generally, the initial dose is 20 ml. Dr. Saab, who discovered anti-snake venom? Kalmety. Who discovered anti-snake venom? Kalmety. How many vials are used for anti-snake venom? 8 to 10 vials are used. Kalmety discovered the anti-snake venom. 8 to 10 vials are used. Cobra, common krait, Russell viper, Soskill viper. Mumbai, Hopkins Institute, 20 ml is the initial dose. Sir, but along with anti-snake venom, if the snake is neurotoxic, we give neostigmine. If the snake is neurotoxic, we give neostigmine. If the snake is neurotoxic, we also give neostigmine. This question came in. The neurotoxic symptoms are there, we give neostigmine. Okay. This is common krait, this is Russell viper, this is Soskill viper. Now, sir, this is a snake which is inside the sea. This is a sea snake. As for sea snake, as for it act on skeletal muscle, SS. As for sea snake, SS. As for sea snake, it acts on skeletal muscle. So it's very simple. It is myotoxic and it causes muscle paralysis. After myotoxicity, there will be renal failure. So that's a trick, is very simple. As for sea snake, it acts on the skeletal muscle. It is myotoxic. It causes muscle paralysis or renal failure. It is myotoxic. It causes muscle paralysis or renal failure. Dr. Saab, this snake, rat snake, is non-poisonous. So if you get a question, which snake is non-poisonous, the answer is rat snake. Dekho, co-cobra, co-common krait, co-coma, neurotoxic. V viper, V vasculotoxic, hemolysis, hemorrhage, DIC. As sea snake, as skeletal muscle paralysis, it is myotoxic, causing renal failure. Very, very simple. Neurotoxicity, give the neostigmine. Who discovered the anti-snake venom? Kalmety. How many vials are used? 8 to 10 vials. This is very, very important. So now I am coming to the next important poison, BB. BB. This is sea snake. This is rat snake. This is BB. Doctor, BB is just like a BV, aapki wife. It is blister beetle mite. Doctor, BB is a blister beetle. It is also known as Spanish fly. Doctor, ye lagti Spanish hai. It is also known as Spanish fly. But when it bites you, it causes canthroid poisoning. When BB bites you, BB agar aapko kaatti hai, so it causes canthroid poisoning. And Dr. Sahab, naam hi BB hai, so it will cause a very, very important symptom, my dear friend, priapism. Priapism, painful erection of penis. Naam BB hai, so aapka painful erection of penis karegi. It's a priapism. BB is a Spanish fly. It is causing canthroid poisoning. What is the main symptom? It's a priapism. It is priapism. Very, very potential MCQ. So what is another name of the BB? Spanish fly. What it causes? Canthroid poisoning. What it causes? Priapism. A very, very potential MCQ. Priapism. Painful erection of the penis. Look, some Spanish fly ki picture. Canthroid poisoning karti hai. Scorpion bite. One question comes in exam. For scorpion bite, the drug given is prazosin. And for spider bite, the drug given is dapsone. For scorpion bite, the drug given is prazosin. And for spider bite, the drug given is dapsone. A very, very potential MCQ. Canthroid, priapism, BB. BB, Spanish fly. Scorpion bite, which drug is given? A very important question comes. It's a prazosin. And for spider bite, which drug is given? The answer is dapsone. Dapsone. Sir, the most poisonous spider is black widow. Just remember, black widow is neurotoxic. तो डॉक्टर साहब अगर आपको पूछा जाए सबसे पॉइजनस स्पाइडर कौन सी है, ब्लैक विडो, काली विधवा. मोस्ट पॉइजनस स्पाइडर इज ब्लैक विडो. ब्लैक विडो. डॉक्टर साहब, नाउ आई विल शो यू द पिक्चर ऑफ calotropis. This question comes in exam, my dear friend. You all know this plant, my dear friend. It's a calotropis. It is a calotropis. Sir, what are the other name of the calotropis? Akdo, madar, and rubber bush. What are the other name of the calotropis? Akdo. It is akdo, madar, and rubber bush. What are the other name of the calotropis? Again, I'm revising, my dear friend. It's very simple. Akdo, madar, and rubber bush. Doctors have two toxin. The number one is calotoxin by calotropis. But sir, you can get this question. That second toxin is uscharine. Second toxin is uscharine. So calotoxin and uscharine are two important toxins. Calotoxin and uscharine are two important toxins. Uscharine. Doctor Saab, which plant has a heart-shaped seed? Very, very potential MCQ. This I will show you the picture, the bigger picture. Yes, this one. Which plant has a heart-shaped seed? It is semicarpus. Which plant has a heart-shaped seed? It is a semicarpus. Sir, semicarpus is also known as marking nut. Semicarpus is also known as marking nut, and it is also known as bilava. Semicarpus is also known as marking nut, and it is also known as bilava. So, Dr. Saab, if you had a question, which seed are heart-shaped seed? It's a semicarpus. Semicarpus is also known as, what is the name of the semicarpus, dear? It is known as a marking nut or bilava. Doctor, why it is known as a marking nut? Because, sir, there are many people, they make a mark on the clothes. You see that the clothing's marker, they use the semicarpus, bilava. And doctor, what are the two toxin? It's a heart-shaped seed. The two toxin are semicarpol. Yes, my dear friend. Two toxin are semicarpol and bilavanol. Very, very potential MCQ. Again, I'm revising, my dear friend. What is the shape of the seed? Semicarpus, heart shape. What are the other name of the semicarpus? Marking nut or bilava. What are the two toxin of marking nut or bilava? Semicarpol and bilavanol. Semicarpol and bilavanol. I have shown you the picture because the picture comes in exam. Sir, chili seed is known as capsicum. This is chili seed. Chili seed is known as capsicum, and Dr. Saab, because of the chili seed, we have dermatitis. Because of the chili seed, we have dermatitis. This dermatitis is known as Hunan hand. Because of the chili seed, we have dermatitis. This dermatitis is known as Hunan hand. Bilava kiska naam tha? Semicarpus or marking nut. The dermatitis caused by chili seed, it is known as Hunan hand. Chili seed is capsicum. Chili seed is capsicum. The dermatitis caused by chili seed is Hunan hand. Hunan hand. Hunan was the place where this dermatitis was detected first in China. Hunan is a place in China. Doctor, what are the method of nasal inhalation? See, if you use container to inhale, it's a sniffing, very simple. If you use plastic bag to inhale, it's a bagging. If you use balloon to inhale, it's a ballooning, very simple, sir. Doctor, container sniffing. Doctor, only you have to remember one thing. If you use cloth piece to inhale, if you use some cloth piece to inhale, that is huffing, because sir, the meaning of cloth is huff. Otherwise, everything is simple. Container sniffing, plastic bag bagging, balloon ballooning. Only you have to remember one thing. Cloth is known as huff. It's a huffing. So if you use cloth piece to inhale, that is huffing. So yeah, by chance आपका inhalation आपके cloth piece में, this you use to inhale. This is huffing. Huff is a cloth. Very simple. Now, sir, a very important word, very important word. Sir, first you spray in the room. Oh, first you spray in the room, then inhale. You become glad, it's a gladding. And Dr. directly aerosol, it's a dusting. Very simple. You have to remember only two. Cloth piece, it is huffing. First you spray in the room, then you inhale, it's a gladding. आप बिल्कुल glad हो जाते, it's a gladding. Again, I'm telling you. Cloth, it's a huffing. First you spray in the room, then you inhale, it's a gladding. All remaining are simple. Container sniffing, bag bagging, ballooning, and directly aerosol inhalation, dusting. You can see this is the picture given. You can see these are the multiple picture given. You can see bagging, huffing, dusting, gladding, spraying or sniffing. These are the picture given. Yes or no, my dear? Simple. Dr. Saab, there are 3 lie detection technique: polygraph test, truth serum drug, or brain mapping. The best test is brain mapping. Dr. Saab, truth serum drug, you can get 2 questions. Either you can get thiopentone in option, and second truth serum drug is hyoscine. So thiopentone and hyoscine both are example of truth serum drug. Thiopentone and hyoscine both are example of truth serum drug. Sir, polygraph test, we ask some question, and when you give answer, we record BP, pulse, respiratory rate, skin movement. So you can get this image in your exam. We put some question, and this is a polygraph test. We record your BP, pulse, respiratory, muscle movement, and everything. This is known as polygraph test. But sir, best test for lie detection, brain mapping, brain fingerprinting, it is also known as. So what are the lie detection techniques, sir? Polygraph test, truth serum drug, which is known as narco analysis. Thiopentone is used in narco analysis. Thiopentone is a very common drug used in narco analysis. Brain mapping is the best. Brain mapping is the best. Now, sir, 2 very important words. Sir, like this is a drug you have taken, and you have put this drug either in polythene or in condom. And Dr. if you put this drug in either polythene or condom, now, sir, if you swallow this drug, this is body packer syndrome. And if you put this drug in cavity, this is body stuffer. What are the cavities, sir? Nose, ear, vagina, anus. This is body stuffer. Again, I'm telling you, sir, you are keeping the drug in polythene and condom, and you swallow, it's a body packer. And you put in the cavity, it is body stuffer syndrome. Swallow and it putting in cavity. Dr. Saab, here the drug is in large amount. So if the drug is in large amount, it is used for smuggling. It is used for smuggling. Here the drug is in small amount. So if the drug is in small amount, it is used for personal use. Again, I'm revising, my dear friend. If you are taking the drug in large amount, it is used for smuggling. And if you are taking drug for small amount, it is used for personal use. Any drug in polythene and condom, you swallow and you go to other country, other state, it's a body packer syndrome. But if it ruptures, your death is sure, my dear friend. So body packer syndrome is for drug smuggling, and body stuffer is for personal use. Just be careful. Polythene condom, swallow the drug, body packer. Putting in your cavity, body stuffer. Stuff करना, जैसे समोसे में आलू stuff करते हैं ना, वैसे आपकी body में stuff हो जाता है. This one is another very potential MCQ. Now, Doctor, I have told you many smell of the poison, but last 3 poison smell you can get in exam. Poison and smell of the poison. Number 1. What is the smell of para-aldehyde? What is the smell of para-aldehyde? It is acrid smell. What is the smell of para-aldehyde? What's the name of the smell, dear? Acrid smell. The smell of para-aldehyde, it is acrid smell. Para-aldehyde, it's acrid smell. Second, what is the smell of nitrobenzene? It is shoe polish smell. Shoe polish smell, nitrobenzene. And what is the smell of para-aldehyde? Acrid smell, nitrobenzene, shoe polish smell. And the last, very, very simple, sir. Last, you can get a question. What is the smell of conium? C for conium. It is carrot-like smell. So again, I'm revising, my dear friend. The poisoning, yes. The poisoning, para-aldehyde has an acrid smell. Yes, my dear friend. Nitrobenzene, it is shoe polish smell. C for conium, it is a carrot-like smell. And sir, conium is a nerve poison. And the common name of the conium is hemlock. The common name of conium is hemlock. So again, I'm revising, my dear friend. Very, very important, sir. Again, I'm revising. Very, very potential MCQ. Dr. Saab, it is very simple. Again, I'm telling you. What is the smell of the para-aldehyde? Acrid smell. What is the smell of nitrobenzene? Shoe polish smell. And what is the smell of a nerve poison? Conium. C for conium. C for it's a carrot-like smell. You can get all these three questions. Para-aldehyde, acrid smell. Nitrobenzene, shoe polish smell. Conium, it is carrot-like smell. Body packer syndrome, swallow. It's for drug smuggling. Body stuffer for personal use. Para-aldehyde, acrid smell. Yes, you can see. Nitrobenzene, shoe polish smell. And conium, it is carrot-like smell. That is very, very important, my friend. And Dr. Saab, this is, yeah, you can this is, you can WhatsApp me for 9910660346. And Dr. Saab, you can follow me on my Instagram channel and you can ask me the question, Akhilesh Raj Jhamar. So WhatsApp number is there and Akhilesh Raj Jhamar is my Insta group, or this is a given Telegram group. You can ask me any query, but sir, remember, my dear friend, very, very important. You can join me in the Insta and you can send me the message and I'll reply in the Insta also. Don't worry. And WhatsApp, you can ask me the query. But sir, again, I'm telling you, this is all about a very, very important class, forensic medicine. A very, very important class, forensic medicine. Are yes or no, my dear friend? So be careful. This class definitely will give you almost more than 15 marks according to me. 100% scoring subject. It's a forensic medicine. Okay, my dear friends. Doctor, wishing you a happy Deepavali once again, my dear friends. Love you all. And I wish like this exam, this December exam should be your last MC exam. You'll get success with flying colors. All need like the blessing of the parents and my best wishes with you. So please be careful, be be confident in your exam, because it's an exam in which you can score very much high. Okay, so wishing you the bestest of luck for your exam. Wishing you the happy Deepavali once again. Good luck. Goodbye. Okay, dear. Okay, bye bye. Take care. Chalo. Bye bye.